recording. Okay. Okay guys, so our lecture today for materials is about casting metals, solders, and wrought metal alloys. I guess when we think about dentistry, the things that we do, we don't think a lot about, metals that we actually use to do any kind of treatment. Most probably the first thing that comes to mind is amalgam, because it's technically a metal filling. But other than that, what do you think, guys? Where do we use metals in dentistry? Where do we use metals in dentistry? Braces, right? Yeah. Bridges, implants, spacers, right? PFM, which is porcelain fused to metal. Veneers, not really metals, right? Maybe partial dentures, right? So there are things that directly like related to a filling or to replacing something, like you guys have said. Someone says, I guess like crowns and bridges, right? Because that's part of it, as we will see. But also like partial dentures, we do the framework of the denture from metal. Implants, definitely metal. And you also mentioned other things that are not directly related to, well, not directly like filling something out, like spacers, like the orthodontic spacers that we do for when a primary tooth fall, like orthodontic wires, right? The orthodontic brackets, these kind of things. So that's what we're going generally to talk about, just the metals that we use. And since I guess the closest thing to us is are the crowns that we use metals to make in a way. We'll talk a little bit more about these as well. Okay, so as an introduction, actually metals are the most widely used material in restorative and corrective dentistry. So again, when you think about these things that you guys mentioned, you can see that metals are widely used in dentistry. And mainly composite is the other thing that is used as filling material. Usually we don't use pure metals directly as just pure gold or pure silver or something like that. We don't use them directly in dentistry because they lack some of the properties we want, and that's why we make an alloy. And an alloy means it's a combination of two or more metals. So we mix more than one metal and we make alloys from them, and usually we use these alloys to do the fillings or to do the work in dentistry. And the same thing with amalgam, which is the filling. Amalgam is actually an alloy, so it's a mixture of different metals. So the metals that we use, or the alloys that we use in dentistry, that are especially used with the lost wax technique, we call them the dental casting alloys. Okay? Do you guys remember the lost wax technique? I know we talked about it, and I think I did show you a video about it. It was when we were talking about waxes, most probably. So, yeah. Anyone else? You guys remember anything about the lost wax technique? Okay. So let's revisit that. Technically, what we do exactly, it's wax, and then metal fills in, right? So let's say you have a tooth that you want to replace, right? Or make a metal for. You build it first with wax, and that's the wax pattern. You put the wax on what we call a sprue, and you pour stone around it. You put it in an oven that burns out completely the wax. The wax will be completely burnt out, and you will be left with an empty space. Then within that empty space, you put metal, and that metal would make the casting that we use. And then you cut it from here, and you can use it. I think this picture is really nice because it kind of shows you the actual steps that we use with the lost wax technique, and these are also here. So it's a technique for fabricating metal restorations. You create a wax pattern of the tooth, you encase it with stone, and then you vaporize the wax with high temperature, so that's the burnout, and then you put the molten metal inside to make the actual casting. Okay, so let's see a video about that here. Let me share my screen. On the other side. So this is actually what is that here that we're looking at? This is partial denture. It's the same idea. We make a partial denture from wax, the framework of the partial denture. As you can see, we build it with wax, and then we're putting these here, which are the sprues. We call them sprues, and these are the things that will make just a way for the metal to pour through after we burn out all of the wax. So here they're just putting the wax on. Do you see her nail polish? And then they're putting this on top. As you will see now, we have all of this ready. That's the pattern that we have, and that is the sprue that we have on here. And then what we do is we pour it with stone or some kind of plaster, investment plaster. We call it investment. So you see they're going to mix. This is a mixing machine for plaster, for gypsum material. And now they're going to pour that inside of here. So this is wax, and we're just pouring the wax on. Now we have that only, that's the only place that is left. So that's the place that will be the guide for the metal to actually fill into place. So this is where we put the wax in a furnace, and that is with high temperatures, and this would evaporate all of the wax that is inside and will leave us with an empty space. This is a machine that will melt the metal, and also it centrifuges, so it actually runs around, and when it runs around it will shoot the metal inside of the thing that we just did, where the wax is. So see, we put now that this is the device that has the wax in it, and this is the metal, the melting metal that we have, or the alloy if you want to say. And then they're just placing it, and this will turn around really quick, and this metal will shoot into the space where the wax was. So it's running and running. And now we're going to take it out, and you see that's where the metal is. And what they're going to do is just break it, and you see this is the pattern that we did already with wax, and now it's all in metal. They would usually sandblast it to make sure it's completely clean, and definitely will cut all the extras. But that is the lost wax technique. That is mainly it. After that, they cut it, polish it, make sure that it looks nice, and all of the work needed for it to be done. Okay, that is the lost wax technique. Any question about that? All good, right? Let's go back to our slides. So that's the lost wax technique, and the alloys that are used with the lost wax technique, we call them the dental casting alloys. Okay, moving on. These casting alloys can be extracoronal, which means outside of the crown, kind of, or covering the crown, or it can be intracoronal, which is inside. And the main thing that is extra coronal definitely are the crowns. So the crown covers the whole thing, right? But there's another thing. Have you guys heard about onlays and inlays? Most probably with the Miss Jukes. I don't know, I'm sure we talked about a little bit. Okay, so you know what inlays or onlays are technically. So these inlays and onlays can be made from metal casting alloys as well. So when we say extra coronal, that would include an onlay, because what is the difference between an inlay and onlay? How can, when do we say this is an inlay and when do we say this is an onlay? What is the main difference between these two? On top. Inside. Only covers a wall. Yeah, in a way, usually we call it an onlay when it replaces a cusp. If a cusp is replaced, it's an onlay, even if it's one cusp. If there are no cusps involved, then this is an inlay. That's kind of the usual difference between them. So an inlay would not replace a cusp. An onlay would replace a cusp, and definitely the crown would replace the whole crown of the tooth. So large area, exactly. Okay, so these are the two differences. Then with the metal alloys also, we have noble metals and we have base metals. Okay, technically the noble metals are the metals that would not corrode or tarnish inside of the oral cavity. So what do you think one of the main noble metals that we would have? Here it is. There it is. Gold. Gold is one of the noble metals that we would have, right? So these alloys that we're talking about can also be classified based on the noble metal content. So we will call them a high noble metal if they have at least 60% noble, and gold at least 40% of that. We call them noble if they have at least 25 noble. It doesn't matter if they have gold or not. And we call them basic or base metal if they have less than 25% noble. So again, the more noble or the high noble, it's better because it doesn't corrode and all of that. Base metals are different. We'll talk about these. They withstand a little bit more pressure, you know, but they're not. They might corrode as well. Anyway, so this is the other classification for the alloys that we use in dentistry based on the noble metal content. Okay, so again, this is just a picture of the, nowadays most probably you will not see gold inlays and onlays, although golds are really, really good. You know, they fit well into the teeth and they have similar properties in a way to the enamel of the tooth. So that's why they're good, or they were, you know, really widely used. Nowadays, they're most probably milled and not metal, like zirconia is metal, but it's like a milled metal that you can put in there. Anyway, noble metals. So the noble metals, as I was saying, one of them is gold, right? One of them, the other one is platinum, and the other one is palladium. So know your noble metals. At least, you know these. These are your noble metals. So gold, so it is classified as carats, percentages, and fineness. And technically fineness is the percentage multiplied by 10. So the pure gold is 24 karat, and that's why he's singing about it. So and also if we want to say a pure gold, we can say it's 100% gold, right? Or we can say it's 1000 fineness. So half gold is 12 karat, 50% percentage, or 500 fineness. Okay, that's how we measure it. So it is the most corrosion resistant metal that we have within our metals. So, and as we said, noble alloys that would not tarnish or corrode easily in the oral cavity or in the oral environment. Platinum, we don't use it that much. It's expensive. It doesn't mix with gold well. And palladium, we use it more because it is good corrosion resistance and it's less expensive than gold. So these are the noble metals that we would mix with our alloys. Silver, although it's a precious metal, but it's not considered as noble because it tarnish and corrode. Okay. Okay, now we talked about the noble metals. and now we're going to talk about the basic metals or the base metals. So the base metals, these are the base metals that we have, and there are other ones, other than the ones that we mentioned as noble. Almost all of the other ones are, considered as base metals. So silver, copper, nickel, zinc, tin, and titanium also. Nickel has the highest incidence of allergic reactions, so some people are actually allergic to nickel, and women, actually, it's an interesting information, have higher rate of allergy than men, like 10 to 1. And they're saying because women wear like jewelry at a younger age maybe, and these have some nickel in them that will develop that allergy, and that's why they have more higher allergy to nickel than men. Anyway, these base metals are useful for removable partial denture framework, and this is the framework of the removable partial denture, because these other spaces will be filled out with acrylic and acrylic teeth. Okay. The chrome, cobalt, or nickel chromium, these are the most used alloys, basic metal alloys in dentistry, and these are usually again used for these removable partial dentures. As I was saying, although base metals are not as tarnish or corrosion resistance, but they're actually more stiff than noble metals. So if you compare the basic metals to the gold alloys, you'll see that they have twice stiffness as the gold alloys, and that's why it can be used for these kind of things. Okay. Moving on. Any questions so far? All good, right? These are the again, partial dentures, and you can see they're all made of the base metal alloys. Okay, now we're done with the, technically in a way, done with the dental casting alloys, right? We have another type of dental casting alloys that they call it porcelain bonding alloys. So they are similar to the casting alloys that we talked about. The only difference is that they made them, from the name, they made them more compatible with dental porcelain, right? So these that you look at here, these are called porcelain fused to metal crowns. So porcelain fused to metal. Most probably you've talked about this again in Ms. Juke's class when you're doing charting, right? You did porcelain fused to metal, something like that? Yes? Okay. So from the name, it's a metal coping. They call this a coping, and it has porcelain fused to it on top of it. So we have some alloys that are made specifically to be used with porcelain, so we call them porcelain bonding alloys. So they're compatible with dental porcelain because we have to fire the porcelain in hot ovens. These metals actually are also made, or these alloys are made to withstand higher temperatures, and they do not expand that much, so they would not crack the porcelain on top of them. Okay. When we're talking about the porcelain fused to metal crowns, the coping, which is the metal part of the crown, must be at least 0.3 millimeters in thickness. So there's a specific thickness to them. The porcelain have to be at least 1.5 millimeters thick. And these thicknesses, these are the least amount of thickness that it can withstand the occlusal loads that we put on these crowns and bridges. So although, again, they might look better, but we have to reduce more of the tooth when we want to make a porcelain fused to metal than if we want to just put all metal crowns. Because technically, if you put in all metal crowns like stainless steel crown, you only need 0.3 millimeters reduction of the tooth. You just need to cut a little bit of the tooth to be able to place the crown on top of it. Porcelain fused to metals are going away, honestly, and nowadays we have all ceramic and zirconia crowns taking place, so there are no like this type of metal inside of them. Zirconia technically is metal, but it's like they were able to work around it and make it more like tooth colored material. Anyway, but porcelain fused to metal, with their usual way, they're going away. They're cheaper than other things, but they're going away because the new material is just getting better and better. Okay, moving on. Now, when we're talking about the porcelain fused to metal, there are multiple layers that they put on. I'll show you a video how actually they make it. So this is our metal coping that we just made. And then they would put a layer of opaque porcelain, and this is technically so it will keep the metal color from showing, because again, this just silver color, we don't want it to show on the tooth. So we make one layer of opaque porcelain layer, and then what we do, we would fire them, which heat them up really hard so they would actually hold together or bind together. And then we start adding these other layers, which is the body and the incisal edge, or sometimes they call it the enamel layer. And technically that incisor or enamel, it's a little bit more radiolucent because you can see through it just like our normal teeth. Anyway, these are the different layers that we have. And at the end, we have to glaze it, and that's also, firing it with a lot of temperature. This would create a shiny surface by the glazing process, and then usually do some coloring to it. Okay, so what I want to show you is this video here. So you can see, well, this is in the lab. What we do in the office, we change, we drill the tooth, we take an impression, and we send it to the lab. And technically what you're looking at is the porcelain when it's mixed, and they're going to put it on the tooth. This is the tooth coping here. Do you see that? That's the coping, the metal coping of the tooth. And you'll see that they will start putting layers on it to build the tooth. And the lab technician will keep forming it and shaping it to the shape of the tooth. And it has a lot of artistic part because technically they have to do all of the anatomical landmarks of the tooth. They have to make sure it's not too high or not too low, where it will blend in with the occlusal level of the patient. It has to fit well and all of that. So they do all of that work in the lab. You can see they're checking the bite and keep working on it, adding now a different layer, and all of that after they put it in the after they put it inside of the furnace or whatever. When they fire it, it would actually turn to the actual color of the tooth, or at least similar color to the tooth, and then they can color it further to make it look exactly like the shade guide that we took for the patient. So see, they're just putting back the anatomical landmarks, adding a few layers here and there, and see that the metal from the inside, we can see it. And now they're going to put it in the oven, the firing thing, and they would just fire it, and they would not show us too much closer look, but you can kind of see how it will look like. Now it looks like a regular tooth. Okay, so that is our that's our porcelain fused to metal steps that we do to make a porcelain crown. Okay, or porcelain fused to metal crown. So let's move on. As you've seen, and as you know now, that porcelain fused to metal crowns have a metal portion. Has a metal portion and has a porcelain portion. So there are three types of the margins that we have for that. Let me see here. It can be a porcelain margin, like you see here in this picture, and technically this is the most aesthetic because you don't see any of the metal part of the tooth. And the metal does not extend to the margin, right? It can be even less than that, like it's just the porcelain is just covering that. But anyway, this also shows it. So you have a disappearing metal margin, which is technically similar to this here. Like the metal is actually disappearing, and you don't really see it, and the porcelain is covering it. So that's a thin, the metal is thin and edge, knife edge like, so you can see here at the end, and extends to the edge of the margin. And the other type of the porcelain fused to metal margins that we have is the all metal, and you can see here again that's all metal. This is the best fit out of all these margins, but definitely it's not aesthetic, so we usually put it on posterior teeth. So if you look at this picture here, you see that this is the edge of the metal for porcelain fused to metal, and you can see it's completely clear, so it's like a metal collar or a metal margin, because it's on the posterior teeth, so it's not going to show as much if it was on anterior teeth, and this would give us a better fit, so they would use it. Okay, any questions? Okay, moving on. Solders, that's another part of the, since talking about the metals. I thought we have, no, we're good. Yeah, so this is technically how to join two metals together. We have three ways in dentistry to do that. We have soldering, we have brazing, and we have welding. So the main difference between soldering and, well, soldering and brazing both need a metal filler. So you cannot just put one metal to another and fuse it together. You need a filler with these two techniques. The main difference between soldering and brazing is the temperature used. So for brazing, you need higher temperature, okay? For welding, you just weld two metals without any filler between them. With a lot of temperature, you can actually just weld one metal to another without needing a filler. Like here, they're adding a filler to fill in the place with like soldering or brazing. Okay. The two types of solders we have in dentistry, we have the gold and we have the silver. The gold one is used with crowns and bridges, and the silver is used usually with orthodontics. Okay, simple things. And that is our last slide. We have also wrought metal, that's how you pronounce it, metal alloys, and these are technically either pressed or extruded. So you can see like we have a metal slab, and then they put it under pressure and into something, and they technically pull it out, and that's how you get that type of metal alloy. So that's after the metal alloys are formed, they're pulled or drawn with press to make them to a specific shape. That's what we usually make the orthodontic wires from, and they're usually stainless steel. That's where we make the stainless steel crowns from as well. So we have the alloy and we press it to the stainless steel crowns, or the endodontic files and reamers as well. One note about that is that the gauge is the diameter of the wire, and the thicker the wire, the smaller the gauge. So when you talk about an 8 gauge, a wire is thicker than the 16 gauge wire. And that ends our lecture for the metals in dentistry. Any questions so far? Okay, let me stop